Hello, I'm Dr. Macon Singletary. I'm your friendly North Raleigh Periodontist. Today we're going to talk about gum recession and some solutions for this and maybe why it happens. So, gum recession. Everybody's going to have a little bit of recession over time. There's active eruption when the teeth come into the mouth and the roots being developed, and then there's passive eruption. Once the tooth is in, the gum goes down the tooth and it seeks a certain level. So the three things that I look at when you come in. But if you call me up and say, my gums are receding, am I going to lose my teeth? Well, don't be concerned. Get in and let me look at you, because there are three things I look at. I look at the position of the tooth, the character of the gum on the front of the tooth, and here's the bone on the front of the tooth. Just because you have recession doesn't necessarily mean you're going to lose the tooth. It can be from inflammation. It can be just from toothbrush abrasion, wear and tear, clenching and grinding. Those are things that we can address in a non-invasive manner that can stem the recession atmosphere that you may be seeing or experiencing. Post-orthodontic therapy. So, just the fact that the gum settles a little bit doesn't mean you're going to have more. It can be a physical or disfiguring appearance to you, and we can address that. There's several ways to handle recession in a way that is comfortable. There are different techniques that we can use. We have different materials available to us. We have your tissue, we have tissue from the side, next to the area of recession. I mean, there are techniques that we can do that can be, that can satisfy your needs. And my assessment of would a recession continue, and if it does, this is what we'll talk about. It may be that you're done. That recession won't get any worse. Well, your technique. There may be something I can recommend to prevent further recession, but we need to take a look at it. We need to be able to tell you what your options are, and we'll be available to do that. So just give us a call, and if you got some concerns, if you've seen that recession, be glad to help you out with that. Again, keep smiling.